Welcome to Age with Intention. I'm Art Aviles, your host, and this is a space for thoughtful conversations with like-minded individuals, which is why I have here our special guest today. The conversation will be about hair loss, PCOS, and because most of my clients are actually women, 70%, I wanted to bring in a special guest. So I'm here. I'm joined by Dr. Dixa, an Ayurveda doctor who helps women understand why their bodies are responding the way they are. So, Dr. Dixa, welcome.
Thank you so much. It's an honor to be here.
Yes, I'm really happy to have you here. So, to start us off, let's go first and ask you, how did you come into Ayurveda? And for those in our audience who may not know what it is or are new to it, how would you describe what actually Ayurveda is?
So, Ayurveda, normally people know it as a treatment science, but we call people who preach Ayurveda, who live Ayurveda, and specifically Ayurvedic therapists, doctors, practitioners, they believe Ayurveda is art of life. It's science of life. Ayurveda has everything in it. You can learn how to live a healthy life. You can learn how to cure a disease. And there's a special motto of Ayurveda which says that swasthasya swastha rakshanam atvarasya vikara prashamanam cha, which means Ayurveda has two main goals. First is taking care of individuals that are healthy. So, you can prevent disorders, stay healthy. So Ayurveda has everything, like a daily ritual, seasonal rituals. That's what we call it. What you got to do at night, when you got to wake up, sleep, everything, right? And it's not just about things related to your body. It's also about things related to your mind. In Ayurveda, we call it Achar Rasayan. That means it is something that teaches you how to think. In short, to be more empathetic, to be just, be more kind and stuff. So that's what Ayurveda is. That is the first aim, to keep the health intact of people who are healthy. And second is Aturasya Vikar. Atur means patient, Vikar means disease. To heal the disorders of the people who have disorders. Simple. So Ayurveda teaches you everything from treating a disease to living a healthy life.
It's a beautiful thing. That's what they call it. Isn't they call it the science of life?
The science
Right?
of
'Cause
life,
it's
the
a
art of
whole-
life, literally. Yes.
whole.
And
Right.
I got introduced to Ayurveda back in 2012. That's when I got admitted in my Ayurveda med school. And at that time, I learned Ayurveda more like as a student.
Right.
I actually, Ayurveda became my life back in 2017 because that's the time when I got diagnosed with Hashimotos. Until then, I never knew what Hashimotos was. In Ayurveda, we are not taught disorders like PCOS or Hashimotos or, different disorders, the new age disorders. It's all Ayurvedic. And I couldn't sleep straight for a week because I was too damn scared thinking that I have to pop the thyroid pill forever. My TSH first time was 20. Antibodies were about 2000. I was too damn scared. And I believe that's when, I started adopting Ayurveda, more like something that I live now. Not something I practice, not
Right.
something I do more like a profession, but it is something I have experienced. Now Ayurveda has become my life. And that's how, Ayurveda became part of my life. I started waking up early. I started going to bed early. I started eating healthy. And more than what you eat, Ayurveda taught me that you are not what you eat, you're what you digest. And that changed everything. That, just being mobile throughout the day and not live a sedentary life, not being too stressed about things. And that helped me manage my autoimmune disorder. And same thing happens. Until today, it's been 10 years since I started practicing. I've consulted almost 26,000 patients. Among them, 90% must be females. And they come with the same issues. Hair fall, PCOS, acne, sleepless nights, depression, mood swings. So that's when I understood that dinacharya means your daily ritual, your daily routine. If you fix that, if you know what is healthy, you'll be able to do it. And that's when I decided that this is something I would like to do.
Right. Okay. So that's pretty much similar to what happened to me because as I was
Really?
telling you, I
Uh-huh.
also studied Ayurveda, and this started back in about end of around 2010, right? And
Okay.
of course, didn't study to be a doctor, but a certified Ayurveda practitioner.
Uh-huh.
And I also didn't focus on myself. It was just adding to my other certifications of
Yeah.
integrated health, right? And until something also occurred to me in my life where I hit a brick wall, pretty much I like to call it passing that threshold when your body's just like enough, there's got to be
Yeah.
change. This happened to me, and I had to bring into account my way of reducing stress. So it was okay. Let me go back to what my dosha is, and then let me see where I am. Oh, I am way, way off track. I started noticing that my imbalances were humongous. This is why I was going crazy with my nerves, having anxiety, to where I even
Oh,
developed atrial fibrillation, right? AFib.
oh my God.
So introducing the calm back into my life, the circadian rhythms, connecting back
Yes.
with the seasons, just getting involved
True.
with nature. It really helped me, do away with atrial fibrillation, not having to do
Definitely.
medications, which was a beautiful thing. So yeah, I mean, I'm very familiar with that, and one thing that's really helped me get back to Ayurveda, right? The science of life. So
Yeah.
that's why I wanted to make sure I'm talking to professional Ayurveda doctors that know a lot
Uh,
about this, and we wanna help others. We wanna help, especially like you
Definitely.
said, 90% of your clients are women.
Yeah.
Mine, there's about 70% of my clients and even
Wow.
followers I looked at on Instagram, women, and the biggest issue, and probably one of my guides that gets downloaded the most is thyroid, right?
Yes.
Hashimoto's. It
Yes.
seems to be something that there's a lot of information out there, but there's just too much of
Yeah.
it to where they don't even know where to start. Like, where's the starting line? And where do I go? So it's great that we bring this up. So one thing I really appreciate about your work is how you reframe the conversation. So you often say hair fall isn't a hair problem and that PCOS isn't a cyst condition, it's
Yeah.
internal feedback. So let's start
Yes.
with that. What led you to focus on, deeply on hair loss? Because I know you talk about it a lot.
Yeah. So first, as I said, I got diagnosed with Hashimoto's back in 2017, and I have massive hair fall. So I remember this one day when I was in the shower. After I came back, I had this much hair in my hand. I was so shocked. I cried until noon, thinking, "What is this? Am I gonna go bald?" Like. Because my mom has Hashimoto's, my grandmom has Hashimoto's.
Mhm.
They didn't even knew they had. All they knew was they had to pop a pill throughout their life, and my mom, even today, she doesn't know anything about Hashimoto's. All she believes is she has a hypothyroid, and that's about it. So I got pretty scared. And then is when, I started taking care of my hair for the first time in life. 10 years back. And then because as I said, 90% of my patients, almost 25,000 of women, when they come to me, be it for any disorder, it could be thyroid, it could be PCOS, it could be depression, it could be something as simple as cough, cold, sinusitis, migraine, or infertility for that matter. But out of those women, there were 85% of, mostly, I would say most of my patients had hair issues. Even if they didn't knew, maybe hair fall wasn't their first complaint. They came to me for migraine. And when I take history, I'm like,
Right.
how's your hair? What's the quality of your skin and everything? 85% of them told me that they have hair fall. And that's when I started understanding that the hair fall is not a disease. I don't consider hair fall as a disease. It's a feedback mechanism. Why? Because if you have
Right.
hair fall, it's not because you're not oiling your hair. That's not the only reason. It could be gut, it could be stress, it could be poor
Yeah.
lifestyle choices. Hair fall is just a simple sign your body is giving you just to explain you that something is going wrong, so you start working on it. Otherwise, you'll have a real full-fledged disease.
Yes, and I know you
Yes.
say, yeah, it could be a digestion issue
Yeah.
so to start, maybe you start there, right? So when someone comes to you, they're concerned about the hair loss. What are you actually looking at inside their body? I know you said digestion issues. Is that where you start?
Yeah. Yeah. Why? Just because you might think that you have hair fall, then why am I even talking about digestion? A lot of patients used to ask me that, ma'am, I am here for this problem and my digestion is good. I mean, they shouldn't be wasting a lot of time talking about what I eat and how I eat and, what I omit and in what vegetable oil do I cook food. That's when I started explaining people about Ayurveda. And now a lot of my patients, almost 90% of them know that if they have hair fall or if they have dry skin or if they have acne, the reason is not just external. It's internal. It's fixing the gut because Ayurveda, just the way, in modern science, we have different systems, different tissues.
Right.
Ayurveda believes there are 7 tissues in body, and we
Uh-huh.
call these tissues as dhatus. Dhatus, right? So there are 7
Got
dhatus. The first is Rasa dhatu, which is lymphatic system. Second is Rakta dhatu, which is your blood system, blood connective system. Third is Mans, which is your muscle. Fourth is Med dhatu, which is your fat. Fifth is bone tissue. In Ayurveda, we believe that your hair and your nails, this both are byproducts of your bone system. That is Asthi dhatu. Then sixth layer is Majja, that is the bone marrow. And seventh and the last is reproductive system, that is your Shukra or the Atha. This is what we call dhatus: Ras, Rakta, Mas, Med, Asti, Majja, Shukra. And in Ayurveda, we believe this philosophy of Shir Dadi Nyay. Have you heard of this before?
Yes, I have, but of
Oh,
course I've
wow.
forgotten some.
Oh,
Don't
lovely,
tempt me.
lovely. Yeah, yeah. So Shir Dadi Nyay means the milk curd theory. Very
Right,
simple. What Ayurveda believes is if you want curd, you need to have milk. The milk should be optimal to be able to have optimal quality of curd.
right.
So from milk, we get curd. From curd, we get butter. And from butter, we get ghee. So if you
E,
want ghee, you should have milk. Otherwise, how do you do that? Right. And
right,
this is an example Ayurveda gives to explain, how every dhatus, every tissues are nourished. So if you want to nourish your bone tissue, because hair, if you want to work on hair, your bone tissue needs to be optimal. For that, your rasa dhatu, your lymphatic system, your lymphatic drainage must be happening optimal. Only then it will be nourished. And that nourishment from that optimal rasa dhatu, rakta dhatu is formed through transformation. Dhatuvagni, that's what we call. Now, if your Rakta Dhatu means your blood, you got to have enough B12, D3, iron, ferritin, all of it in order to, just make it full-fledged nourished. Then comes mass, so your muscle should be strong. Then comes made. Made means your fat. So if you have optimal fat only, then you'll be able to digest and absorb vitamin A, D, E, K because these are fat-soluble vitamins. And you also cannot have excess of fat. Otherwise, that because you have more of fat tissues, neither are your bones formed well, nor is your reproduction system well. And we know that most of women with infertility or men with infertility will have insulin resistance, PCOS, will have belly fat. What is that? Because they have the more nourishment is taken by the fat tissue. So the bone and the reproductive system tissues are not formed well. So
right.
that is why, you come to me with hair fall. I'm not just going to look at your hair or consider if
Exactly.
it's thin or, we got to fix, what's
Right.
what's the root.
Yeah, it's not just gonna be like here in America, they want quick fixes. They want a
Yeah,
shampoo that's gonna help their hair start growing,
same
all
here.
that good stuff. And don't get me wrong, there is good things you could also do. And I know
Yes,
you've talked about that, but I know there's a lot of early warning signs that obviously have to do with deeper imbalances. And you just covered those, those 7 that you look at, which is great.
yeah.
And, speaking of hair loss, that can be very emotional for women. I know I've seen them
Oh,
start
yes.
crying. And
Uh,
then with
uh,
PCOS to add to it, so from an Ayurveda lens, you already talked about what really is happening in the body with not just the hair loss, but with PCOS as well. So,
yeah.
a lot of people think that this is purely a hormonal issue or it's just random. But the way you put it, you're saying this is information coming from your body, right?
Yes, definitely. Ayurveda considers PCOS as a Kaphaj disorder. You know well that alone Kaph or alone Pitta cannot do anything without Vata. Just
Right.
just to give audiences, a little idea about Vata, Pitta, and Kapha. So Ayurveda,
The
like,
doshas, yes.
yeah,
I
doshas
call
are
them
the pillars of
biotypes, by the
Ayurveda.
way. So I call them biotypes just to make it
Yeah,
easy for people
biotypes.
to
Yeah,
understand.
yeah,
Yeah,
just to make it easier, So Vata, Pitta, and Kapha are the biotypes, These are the pillars of Ayurveda. You
right.
look at anything with the lens of Vata, Pitta, and Kapha, you'll know what's the treatment. And you'll understand what's the cause. And Vata, what is Vata? Movement. Everything that has to do with movement is Vata. What is Pitta? Metabolism. Everything that transforms in your body. Metabolism is Pitta.
The
And what is
fire,
kapha?
yes.
The structure.
The
It gives
structure,
you
yes.
structure, the nutrition, the nourishment is kapha. So when kapha increases in body, it leads to blockages of
Right.
channels, right? And because channels are blocked, the pitta also gets deranged, there's inflammation in body, and vata can definitely disrupt periods. So this is not something that's only related to the menstrual cycle of a woman. If we talk about PCOS, it's
Right.
related to overall inflammation, it's related to blockage in channels. And in
Exactly.
most of my patients with PCOS, I have seen that the HbA1c is definitely higher. Normal modern medicine doctors would give them metformin for that matter. And
Right.
even then, they have to be on that. They'll be dependent on that, and still things are
Hmm.
not working out.
Right.
It's a, it's your gut, because we know that 85% of hormones are produced in the gut, right? If your
Right.
gut health is poor, you are eating healthy. Let's say you are eating healthy, you're also popping supplements, then why are things not working? Because Ayurveda says this loud and clear: we are not what we eat, we are what we digest. So it's not about popping pills. Popping pills cannot fix PCOS ever. It's about correcting the gut. And
Right.
that's how
Yes.
it works.
Yes, and that's the stress levels, increasing inflammation in the body,
Yes,
bringing irregular routines, affecting the hormones, and that's the hair
definitely.
loss. And then, yeah, like you said, some people don't realize it. They do have some gut issues because it's not just because you're not bloated, but we
Definitely.
have to look at that, go deep into the biotypes, the doshas, see the imbalances. And
Definitely.
that's why I love Ayurveda. You could right away tell just by doing an imbalance assessment, right? And you can see,
Yes,
oh wow,
yes,
even though you're a kapha person, which is structure, but you're excess in vata, right? And then
yes.
your pitta is low, which means your fire is low in the gut. So we have this issue here that we have to come in and go root cause instead of looking for these supplements or metformin, like you're
Definitely.
saying, right?
Yeah.
Yeah, so we know that someone can have normal labs too. I know this is something that I do, and I just
Yes.
laugh because, I do my physical every 6 months and things come out normal, but there's something there. So imbalances usually don't come up, which is normal labs. That's why root cause is best. What do you think about when people go in there and say, well, my labs are great, but I don't
Yeah,
feel well?
I don't feel good. Yeah, yeah. So if we talk about Ayurveda, Ayurveda says that a disease, any vyadhi, it develops in 6 stages, right? So it begins with Sanchay, then Prakop, Prasar, Sthana Sanshray, Vyakti, and Ved. These are the 6 stages. To simplify, in the first 4 stages, you just get couple of symptoms. Initially, you get it rarely, and then you start getting it often. And in stage 5 is when the disease manifests.
Right,
In
stage
stage
five. I
5 is
remember
when
that.
we can
Mhm.
see that in the reports, okay? So if you go for all tests and it turns normal, but you do have symptoms, you're mindful, you know that your gut is improper, you're constipated or bloated, or you have hair fall, or you have belly fat. If you have got symptoms, we need to start treating the disease right then. We need to just start understanding what the root cause could be. Once we are able to find that, we don't have to wait until we see the reports, because I do have a lot of patients from overseas, and they would tell me that it's not possible for us to just, in India, it's very easy. I want to get a blood work done tomorrow. Even if I'm not a doctor, I can just enroll myself, and tomorrow a person comes home, they'll collect the blood. Day after tomorrow, I have my reports.
Right.
It's simple, but it's not like that in any other country I know. So they will be like, I got an appointment, but it's after 6 months. So what do I do?
Yes.
Do I consult you after 6 months? I'm like, no, you don't have to wait. Reports are important, but I would always say reports are secondary. How you feel is
Right.
primary.
Secondary.
Listen to your gut. And
Mhm.
all my patients, whoever come to me with whatever disease, the first thing I tell them is, what we are learning here, what we are going to be doing for the entire maybe 3 months, 6 months, a year, is trying to understand your body. Is you trying to create that good relationship between you and your body, so that you can hear your gut instinct, what you are, where you are, you don't feel lost. Because if your relationship with your body is great, then your relationship with everything is going to be wonderful. No amount of external stress can damage your internal peace if you know yourself. If you're here in this body, you're mindful in this moment. And that's what Ayurveda teaches us to learn.
Your
So
unique
reports,
self. Yes.
yeah, definitely. Reports are not mandatory. What you feel is something you should just look out for.
Right. Great. Yeah, that's great information because that's one thing I often talk about is get back to try to self-regulate. Of course, we need to learn our bodies
Yes.
so that we're self-regulating more and stop
Yes.
being dependent or outsourcing our health when we could actually go within. So that's great
Definitely.
information there. Now, I did talk about, yes, there are external things you could do. And I think I've heard you talk about oiling the scalp weekly with
Yeah.
coconut oil with castor oil, right?
Yeah, there are different oils. It's Bhringraj, coconut, Brahmi, castor oil, a lot of things. So first, why does Ayurveda talks about an external thing? When Ayurveda says that you need to fix yourself internally in order
Right.
to heal any disease, right?
Right.
Because yeah, but in India we call scalp massage as champi. This is what we call it, champi.
Chumpy. Yes.
This when you massage your scalp, it's not just an external thing. We know that your skin absorbs everything you apply on
Mhm.
it. That is why a lot of people get cancer just because they are using really chemical based moisturizers
Right.
and different things like that, perfumes. But what Ayurveda says is this is not something that just gets absorbed. When you massage your head for good 15-20 minutes, slowly, and with tad bit of pressure, it helps your nervous system work in parasympathetic mode, rest, digest, relax. So you're no longer just functioning in this survival mode, fight and flight. So, first, you will feel relaxed. The first benefit of massaging. Second, when you massage with different specific oils, like if you use Bhringraj is an Ayurvedic herb. In India, we call it Keshraj. Kesh means hair, Raj means the king. So Bhringraj is more like the king of all herbs which we use for hair. So you come to me with any hair problem. It could be alopecia, it could be thin hairs, it could be lack of new growth, or it could be something as simple as premature graying, which is something that I see often now in even kids as young as 8 and 9 year old. Imagine. Yes,
Yeah.
because they are definitely pitta is high, and
Right.
all the daily routine also involves aggravating pitta a lot, so
Mhm.
that can happen. But when you use oils infused with Bhringraj, that improves the hair follicles. It just produces new hair follicles, which gives rise to new hair,
Right.
right? If you use the castor oil, castor is best for vata shaman. It reduces vata. So a lot of people have dry hair, frizzy hair, very dry scalp. Castor oil is best for
Yes.
them. And those who are overthinkers,
So that's
overworkers, pittas,
yeah,
for them,
so but
coconut is
isn't it
best.
isn't it, like excess vata when they have that dry scalp,
Yes,
right?
yes. Dandruff is also sometimes because of dry
Right.
scalp, in which
Mhm.
castor oil, along with some neem, that is,
The name.
neem, curry leaf neem, that works really well. You can even use something as simple as lemon and salt. It works. But this is external. It
Right.
works. For example, if you get burn in your hand, and you
Right.
pop a pill, it will work, but you'll also have to apply something to soothe it, right? Like if you apply ghee, if you apply aloe vera, it will work. In the same way, internal, you start eating healthy and do a couple of things. Externally, also, oiling is something. You try oiling once, you'll never want to, leave it because it's so appeasing and so relaxing,
It kicks in the
emotionally and physically
parasympathetic.
great for hair.
Right. Yeah, I love that. I mean,
Wow.
of course, it feels better when someone's doing it for me, than me
Definitely,
doing it
definitely.
myself. I always try like, "Oh, I wish I could feel like somebody else's hands is going."
Yeah.
It feels amazing. It really like, for me, that I need to be in a calm state often, of course, I use a simple breathing technique that I use
Yeah.
to bring calm to my body. I don't wanna ever
Mm-hmm.
experience that AFib again, and it's been 4 years since that occurred, and knock on wood, like they say over here in America, knock on wood, won't happen again, but I gotta bring back that calm state, and that's one of my go-tos, these breathing techniques, but massages, finding things that it's gonna bring down the stress level, the cortisol, right?
Very
Of course,
important. Yeah.
hormonal. It's a hormonal thing that's happening there. So, what are some everyday habits that you see that worsen hair fall for women? I know there's habits that they do that actually are making things worse. What are some that you see and people are not realizing they should probably stop?
Yeah. So the first is definitely not going to bed by 10. Late
There you
nights.
go.
Late nights
Late
are the
night, huh?
worst.
Mhm.
Yeah. So late night. You sleep late, you're going to wake up late. So everything is going to be delayed. And what Ayurveda says, circadian rhythm. You wake up with the sun, you go to bed with the moon.
Yes.
So this one thing can disrupt your cycle for the entire 24 hours. Right. So Definitely late nights, eating junk, not eating on time, not respecting your gut, not being mindful about a lot of things, Specifically, Ayurveda says that, as I said, I keep repeating this again and again. You are not what you eat, you're what you digest. So
Right.
even if there's a jar of nectar in front of you, you're not going to be able to digest it if you're going to be in rush while you drink or eat it. You got to be mindful. You got to eat it warm, freshly cooked warm food whenever it's possible. So eating on time, respecting your appetite, not eating just because dietitians say that you're supposed to have this for breakfast. No, you're hungry, have the breakfast. You're not hungry, skip it.
Right.
So,
Yeah, it's
I've
one of the ways to not get too stressful, right? You can't be too strict.
definitely.
Yeah.
Definitely. And sedentary lifestyle. So what yoga says, yoga is considered more like a sister science of Ayurveda. And yoga says that a moving body, a mobile body, and a stable mind is the key to
Ri
health. But we practice opposite. The body is stable, it's here all the time, it's sitting and working day and night at different time zones, and your mind is rushing like anything. You are here,
Yes,
your mind is somewhere
see that a
else. We
lot.
keep on. A lot of my patients have, tell me that they're working. Most of IT people, they work online and they're like,
Right.
it's not one tab. There are like more than 100 tabs open. I'll do some shopping while I'm working, and then the WhatsApp is open, and then this is open, and
Yes,
I look at my phone. I want to call somebody. I forget why did I take the phone in the first place. It's not that they are losing memory. It's just that they're not focused.
yes. It's a scramble. They want us all scrambled. Even when you get home,
Yeah,
you're on the phone, you'll get on that TikTok or the WhatsApp and you keep going. You're on a constant rush, and
it
then they
doesn't
go to
stop.
sleep, and then they wonder why their brains or minds are just going and going and going, and they can't
Yeah,
sleep. They don't
true.
find the relaxation. They're not kicking in that parasympathetic state, and it's something we have to re-practice, I think. Let's say, people are usually in a rush, right? It's a fast pace, and if you had
Definitely.
to narrow it down for them, what would be your top 3 non-negotiables to bring back that hormonal balance, which will help the hair grow again, which will help, PCOS? What would be the top 3 non-negotiables for you if, like, they had to do
Mhm.
at least 3 things?
So first and mandatory, non-negotiable would be fixing the gut.
Yes.
Obviously, because coming back to our Shivdadi Nyai, the milk curd theory. So, if you want your bone tissue and your reproductive system to be optimal, your aharas, all the nutrition that we get from everything that we eat is aharas. From that, your rakta dhatu, mouse made, all of them are nourished. So you got to fix your gut, and the easiest way to fix your gut without any medications, without any rituals, is to follow the sun. That's what I believe. That's what I do. That's what I tell everybody. In the morning, the sun rises. In the same way, your digestive fire also rises.
Right.
At that time, it's more like, we in India, we do light a lamp, in front of our deity. That's how we pray. So when you
Right.
light a lamp, you need to put some oil or ghee in it so that the lamp stays throughout the day. It's up.
Right.
So in the same way, in the morning when the gut, your metabolism has just ignited, enlightened. You cannot have overnight soaked chia seeds and oats, and you cannot have bread. I don't suggest people do that. Why? Because it's like pouring a bucket of water on the agni that have just ignited. You got to feed it something warming, soothing, and easy on the gut because the sun has just risen. It is not too strong. So
Right.
having something as simple as porridge, it could be any millet porridge, but not with sugar. It could be a normal porridge, cooked, freshly cooked, warm. In the afternoon, the sun is right at the peak in the sky, and so is your
High fire.
digestion. Yeah, so that is why Ayurveda says the biggest meal of the day should be lunch. You're not hungry, you can skip your breakfast. You're not hungry, you can skip your dinner. Never skip your lunch. And your lunch can be
Right.
heavy to moderate depending on your appetite. And again, the sun sets in the evening, and that's when we have our dinner. So, dinner is also something that is supposed to be lightest. Again, vegetable soup, a lentil soup, or a porridge is great. So, if you just follow this, it will help you 90% fixing your gut.
And that's
It will
amazing,
also
just
help you be
following
more
the sun,
mindful.
right?
Yeah, just
And it
follow
makes a
the
lot of
sun.
sense, makes a lot of sense. If you picture it, you close your eyes, you see the sun coming up. It's not as hot yet, so take
Yeah,
it easy. Once it's in the center, that's the heat, so that's your digestion already in a
definitely.
fire. That's when you can have your heaviest meals, and then as
True.
the evening comes, I mean, you gotta take it down. There's people having humongous dinners, like,
Yeah,
big
yeah.
festive dinners, and then they wonder why they can't go to sleep. You know, you have a full
Yes.
digestion there. So the sun makes a lot of sense. That's great, great advice. I mean, that's the one non-negotiable you need. There you go.
Yeah,
Start with
yeah.
that.
And it's
Follow the
easy to
sun.
follow. You know, you don't
Yes,
have to remember, look at the sun. Everybody knows the sun rises in the morning, sets. Even a 3-year-old kid knows that, right? So we can
yes.
definitely practice that. Second, I would say is oiling your hair, definitely, because if not, I'm not saying every day or every alternate day, at least once or twice a week would also be enough. You oil your hair, keep it for 3 to 8 hours, then give it a gentle hair wash, and that's about it. Oiling is important. And another of my favorite ritual that will help with stress, that will help
Okay.
improve sleep, improve hair, improve your memory, everything is nasya. We call it nasya in Ayurveda. Nasya means putting ghee or different Ayurvedic oils, nasal oils in your nostrils before you go to bed. So before you
Oh,
sleep, you
that's
put
nice.
either A2 cow ghee, or there are different oils like Anu Tailam, Shadbindu Tailam. They are a combination of certain herbs. So why and how this works is Ayurveda says Nasa hi sirso dwaram, which means nostrils are the gateway to your brain. The easiest way you want any medicine, for your brain, if you put it in your nostrils, it reaches there
Right here. So
very quickly.
he's the
Yeah,
easiest. Just right there.
yeah, yes, you put this oil, and this is something that everybody who has a Pitta Prakriti should practice
Mhm.
because they have a lot of heat in their body.
A lot of heat.
I have seen that in just 6 months, a lot of people with premature graying have seen the premature graying has stopped. For few, we have even seen that it has reversed to some extent just by doing Nasya. So
Wow.
this is something that's great. Follow the sun, oil your hair weekly, if not more, and do Nasya every day. Simple.
Simple as that. Wow. And how about
Yeah.
one last question before we wrap it up? What about any of the myths that you hear? Because, again, there's a lot of confusion out there. And any of the myths out there that you wish people would stop believing, actually.
Yeah, so there's this one where people tell me when they come to me, they're like, "Oh, I have hair fall in my genes. My mom,
Right.
my dad is bald." See, yes, genes do matter, genetics matter, but with right lifestyle, you can change the gene expression.
Right.
So
It's gene
hair fall is
expression.
not genetic. You can change everything. Nothing is genetic. As long as you follow the same habits, food, and lifestyle like that. So you
And that
can
goes for
change. You can do.
Hashimoto's.
Yeah,
Yeah.
definitely, definitely. If I had known all of this before, I wouldn't have gotten Hashimoto's, I feel, but it can stay. It is in remission, since I follow the sun is all I do. I don't eat after 7. Once the sun sets, and that's about it.
That's one of the best things that I've done as well, because I used to eat late, even though I knew to follow the sun. Sometimes you work with people that you come out late and you want to go out and eat dinner late, and that was a bad habit of mine. Boy, what a difference when you start applying
Ye-
dinners at 6, anything
Wow.
before 7. You sleep much
Yes.
better, you recover much better. The
True, true.
inflammation goes away because I had issues with my pitta
Yes.
was so high, so much fire, so much inflammation in my joints, and I could tell when I do break that rule because sometimes you're gonna go out with
You're
family
going to
and
have to,
friends,
yeah.
and you're gonna do that. I feel it, like, "Ooh, my joints feel a little, inflamed today."
Yeah.
I know why, we
Yeah.
were out late eating dinner, so, yeah, that makes a lot of sense. So, how about for people anyone listening who wants to learn more about you, where's the best place they could find you? Give us, probably your Instagram, your website, and then I'll make sure I'll write it
Yeah.
down for them too.
Sure, sure. So, you can find me easily on this my Instagram page that is Dr. Diksha Healing Souls. And I do
Okay,
share
great.
everything about Ayurveda there.
Yes, and you do. I follow you, so I know you do. Dr. Diksha, thank you so much for this conversation. Obviously, we could go
My
further
pleasure.
into this, but I'm happy to get at least 30 minutes of your time and just to help people and remind them that hair loss isn't something to fight. It's something to understand first, your
True.
body, and then for everyone listening, again, don't focus too much on the symptoms, but the signals. When you address the
Yes,
root, the body follows, right? And again,
definitely.
follow the sun. And I will make sure I keep that in mind, and we'll make some notes for people, and we'll put some clips up on Instagram so they can see
Sure,
Dr. Disha at work. And other than that, well, thank you so much, Dr. Disha. We'll stay in touch. We'll see if we could do another one
sure,
on another
sure.
topic soon.
Sure.
Okay?
Definitely.
All right.
Definitely.
Thank you so much for everyone. Thank you. Peace. Take care. Bye-bye.